using is you're going to use the middle phalanx as the fulcrum, alrighty, and you're going to use either perpendicular to the floor or to the horizon or parallel to the horizon as your stationary arm, and the distal arm, okay, is going to be following the object that's in your hand, right? Because this is supination and pronation, right? Right? Since it's in the horizon, it's in the transverse plane or the horizontal plane, it's kind of hard to sort of, pick a spot. So to help with that along, we have them hold their hand in a neutral position, closed-fisted, and have an object in their hand. And you're going to use that as your moving arm, yes or no. Right? Because it's just a little bit easier, and it makes it easier to get the motion. Right. So, can you actually put your hand like this for me, right? Against here, against your thorax. Your thorax. Yeah, okay?
Oh.
Okay? Yeah, sorry, can't lean. Not on this one. Alrighty, so this is the position that she's gonna be in when we're measuring her. Now, if I wanna do the passive range of motion first, there's a few methods that you can do, okay, to do this. Alrighty, first one is you can, relax a second, you can have them just hold your hand like this, alrighty, and you're sort of, having, I guess like an arm wrestle kind of position in a way, alrighty, and you're gonna just relax, alright, passively go into supination, and then passively have them go into pronation. Try to relax as best as you can, okay? Don't help me. Right? And you're gonna feel for the end field during this, okay? Right, and the end field would be firm. It's more of a firm end field. Pretty much, I would say 90% of the end fields, right, if they're normal, they're firm, okay? Right, so you're gonna bring one into supination and one into pronation, right? Other methods have been done. They hold their hand like this, okay? Right? But the most important thing is you want to bend the elbow to 90 degrees, right? Because why do you need to bend the elbow to 90 degrees?
Externally.
Mm-hmm. Right? So we don't let any motion that may occur, right, in the shoulder. So, what you want them to do, okay? Hold the pen. Go like that. Alrighty. Now, do everybody's wrist and hand line up in this nice neutral position that Nakia is in right now? No. You're gonna need to do the best you can. Alrighty? You're gonna have to pick your landmarks accordingly, okay? She's good. Alright? Some people, if they have arthritic changes, alrighty, they may have their wrist in like a flex position already, okay? Alrighty? You can ask them, try to get it up into a nice neutral position. If not, you're gonna have to do the best you can, figuring out looking at it, where your moving arm is gonna be lining up, right, and where the perpendicular arm is gonna be lining up. Okay, where the stationary arm is gonna be lining up. Right, so I'm gonna have her hold like this. Okay, right. Now, not everybody always has a pen. Sometimes people just sort of use that third knuckle thing to line it up with. If they have that, then you could sort of use your imaginary line to do it. Can you go like that? Okay, thank you. I just asked her to close her fist a little bit more, alright, so I could get a slightly better alignment. Okay. Right? So I'm gonna pick a spot, alrighty? Like I said, sometimes their knuckle sort of lines up with everything. Her knuckle just doesn't. Her PIP joint doesn't line up with everything. So I'm gonna pick a spot right in the middle of her third phalanx, right? Just to sort of like get an idea where everything is. You guys can't see? Right? Typically, it should line up. Alright, it's not lining up for whatever reason. So I'm just gonna pick a spot right in the middle. And I'm gonna remember it, alright, where I put that spot. Alright, so I'm holding it right there. I'm gonna use perpendicular to the floor. Can't really be too close to it because her hand is actually in the way a little bit. So I'm gonna be aligned to the side, making sure everything's perpendicular. And Alright, so, can I just see you bring your palm up for me, please, on the camera? Very good. So I'm gonna see where everything goes, okay? Can I see your palm go down now? Alright. Alright, so what would I be looking out for while she's doing this?
Her arm coming away from her body.
Say again?
Her arm coming away from her body.
Okay, her arm coming away, okay, if she's
Lifting her
abducting,
shoulder.
lifting her shoulder, alrighty, flexing her wrist, okay?
Maybe a deviation.
A little deviation, what else? She did a little bit of it. She extended her wrist a little bit through the whole thing. So you wanna make sure that she is in a good position, that she's in the same alignment as when you took the initial measurement, right? Sometimes you do, if you can rest them here as long as it's not offsetting her posture. Alright, so try it, this time when you do it, try not to keep your forearm straight, okay, I know you've been like that for a while now. Bring it down, bring your palm up, alrighty, and bring your palm down. Okay, so I can see what's going on, good, thank you. Alright, line everything up. So, on the count of 3, can you do it one more time for me? Go palm up. Alright, pick my spot. There it is. She has 91 degrees of supination. Okay, from 0 to 91. Now for pronation, okay. Alright, on the count of 3, turn your palm down. 1, 2, 3, go. She has 86 degrees of pronation, right? Which makes sense, because pronation is always gonna be slightly less than supination. Yes or no? Okay? Are we good with that? Okay.
For some people.
Huh?
For some people.
For some people, why, who broke their arm? Switch out the drop. Okay, alrighty, so, okay, now, alrighty, your supinator muscle, where is it? On the-
Palmer side.
On the palmar side of your forearm, and
And,
off, off what?
it wraps around, right?
Yeah, it wraps around, starting at the lateral epicondyle area. Alrighty, going over to the ulnar side, it wraps around. So what's there that's in the way? Other muscles, okay, you got, have your whole your extensor mass that's kind of in the way also. So, what you need to do, okay, alrighty, again, it's sort of take, this way's better for me, okay? What you're gonna do, I'm gonna sort of just push everything aside, alright, or retract it a little bit. Now, start this way, sorry. Alrighty, now can you just turn your palm up? Alright, if you go right down, okay, do it one more time, okay, go back, okay, I'm gonna put my hand, is that okay? Alrighty, alrighty, right where your biceps tendon is, alrighty, alright, and you're gonna ask them to supinate, okay, go ahead, turn your palm up. You should feel the contraction of your supinator muscle coming into play, go back, alrighty, so I'm just gonna sort of retract everything, get it out of the way, alrighty, and try it one more time, right? And you can feel that coming into play. So I'm starting from my epicondyle area, sort of get that mass out of the way, right? Sort of, and then you're just gonna palpate slightly deeply, alright? Put your palm down, now turn up, alright? And you can feel her supinator muscle coming into play.
So where your thumb is, or your
Fingers. I'm just putting everything out of the way. It's where my fingers are, okay? Alright, so I know where that is, okay? Alright, so what I want you to do, let me see you do it one more time. Turn palm up, okay, cool.
Keep a fist or?
Relax it, okay, as best as you can. If you feel like you need to fist, and most people will feel like they need to fist, why? They don't like to keep their hands like this, why? It's tiring, okay? Alright, so what you wanna do is just relax your hand, alrighty? I don't, okay? Put your other hand here and hold yourself, okay? Now, and I'm gonna stabilize here a little bit too, alright? Now, like I said, there's two ways of doing this, okay? You can use the heel of your hand, okay? And I'm gonna be more at the ulnar, so it's the radial border, alrighty? Alright, and I'm gonna prevent her from turning her palm up, okay? So on the count of 3, I'm gonna resist you now, alright? Alright, okay, ready? 1, 2, 3, go, 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 go. And I can't really get a good grip on it, so I'm gonna use my web space now to do this, okay? Alrighty, so what I'm gonna do, alright, I'm gonna do the same thing, alright? But alright, on the count of 3. 1, 2, 3, go, 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 go. A little bit harder, right? Yeah, because I needed some leverage on it for resistance. Okay, so you're going to be either using the web space of your hand or the heel of your hand. Don't do this, alright? Put your hand right around my hand, alright? What do people tend to do when they're doing something like this? Squeeze really hard, okay? Turn your palm up, alright? And they're gonna end up getting a lot of like Indian burn, a lot of shearing forces going on between your hand and their skin. So you wanna try to avoid the grip. Yeah.
I mean, your positioning here, would it not be better if you were more side on, so that you could stabilize with one arm, and then you would have more?
Depends, I mean, I was okay.
It's all personal.
Yeah, it all depends on me. I was okay because she's sitting low and I stood back up.
Right.
Alrighty? So it really depends on your body mechanics, right? And also, I was also using leverage of the table to support myself when I'm doing it. And so it really depends on how you're gonna be positioning yourself. Alright, and depending on the size of the
But
person.
it doesn't make any difference if you decide that that's a more comfortable position for you to get purchased.
No, because remember, I'm looking at your body mechanics when you're resistant. Alrighty? My body, same thing, can you put your hand here? Alright? Your pronator muscle is a bit deeper, okay? It's a bit deeper than the rest. And so what you wanna do, okay, to palpate for it, what mass is covering it? The brachial, maybe a little bit of brachioradius, but more of your flexor mass, right? So what you wanna do, try to get that out of the way also, alright? Alright, I'm gonna start from my medial epicondyle, alright? Sort of move my medial mass over, alrighty? Alright, can you turn your palm down now? It's really deep. Relax.
So you move the muscle mass laterally.
Yeah, I moved it laterally for me. I just moved it laterally for me. Okay, can you try that? Okay. Okay, one more time. Yeah, now I got it. Alright, it is deep. It's a lip. Right? When you're palpating for your flexor mass, you want to try to move it over a little bit more laterally as best as you can, alrighty, and palpate a little bit deeper for it, right? Because it's covering under everything. Right? Okay. So, right, it's pretty much in your cubital fossa area. Right? Try one more time. Like that. Right? Try to get to your, right in the crease, okay? Right in your medial, in your elbow crease. Everybody knows where your elbow crease is, right? Right there, right there. Right, now, go, turn, yeah, right there. And I would feel her pronator teres muscle coming into play, right? So now if I was resisting her, okay, right, can I just see you do that one time? Actually, go back. Bring this back over to you. Okay, right? Okay, bring it down, turn your palm down, nice, okay. Alright, if I want to stabilize and palpate for the muscle at the same time, I'm gonna need to stand. Alright, I already know I'm gonna need to use the web space of my hand to do this, okay? So on the count of 3, you're gonna turn your palm down and I'm gonna resist you, okay? 1, 2, 3, go, 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 go. Ooh, and she's strong. She's strong in this one. Alrighty, so I'm just gonna resist that motion a little bit. One more time, okay? 1, 2, 3, good. Alright? Yes or no? Alright, and again, remember, all these big muscles, your pronator and your supinator. No, they're not big muscles, so the amount of resistance that you're giving is gonna be variable. Right? So it's not gonna be the same thing as same type of resistance that you were gonna give to your quadriceps muscle or something like that, or your biceps muscle. Right? Now, horizontal plane. Right? So we have to try to get that out of the horizontal plane as much as we can. Right? And the way we're gonna be doing that is basically sort of having her go shift into shoulder flexion a little bit, right? While maintaining the 90 degrees of elbow flexion. Is the best way to do it? Probably not, because we're trying to, it's not 100% gravity eliminated. It's probably more gravity minimized than anything else, right? Because just the way of the orientation of muscles, it's wrapping around the bone, right? For the supinator muscle and the teres muscle, pronator teres muscle, it's just a little bit more difficult to 100% say, hey, this is a gravity eliminated position. Right? We're just sort of minimizing the effect of gravity as best as possible. So she's gonna rate you, okay? You want me to do it on the other one?
No, this is okay.
You got? Okay. Alrighty, can you just sort of bring your shoulder up to like 45 degrees of flexion? Alright, you know where 90 is, you know where 0 is, somewhere in the middle. Alrighty, something like that. She's still gonna stabilize herself, so can you hold your hand there? Alright, just keep everything. Keep your thumb up. You always wanna start in neutral. I'm gonna support her down here, alrighty? And I'm gonna palpate for her muscles, alrighty? I'm gonna start with, we'll go supination first, alrighty? Alrighty, so can you just turn your palm down? Oh, I said the wrong way. I meant this way, sorry. Alrighty, so turn your palm up for supination. Move my hand over. Turn your palm down for pronation. Okay? Yes or no? Alrighty, is it 100% gravity eliminated? Probably not. Okay, so, alrighty, can you just turn your palm up for me for 1 second? Okay, palm down. Good. Alright, I'm just gonna palpate for the muscles again. Alrighty, turn your palm up. Okay, nice. Alrighty, turn your palm down. Good. Yes or no? Alrighty, minimize as much as possible. Having her shoulder in a 45-degree angle, okay? And then having her do supination and pronation from a neutral position. Yes? Alrighty, so